Nerve cell, basic structural unit of the nervous system. It can be asked in histology, it can be asked in the brain or spinal cord. Just simple, what is this nervous system? Neuron, nerve cell, basic structural unit of the nervous system consists of nucleus, nerve fibers, dendrites and axon. Just simple. Don't complicate matters. And nerves, there are sensory nerves, carry messages to the brain and spinal cord from body, and motor nerves carry messages from the brain and the spinal cord to the body. Nerves carry messages to the brain and spinal cord from body. Motor nerves carry messages from the brain and spinal cord to the body. Connecting or mixed nerves. Now carry both sensory and motor messages. Connecting or mixed nerves. I would prefer mixed nerves. The word mixed nerves. So you can see that carry both sensory and motor messages. Am I clear? Connecting it, it will have the neuronal connections to the brain, to the spinal cord, and then it can be a breakup. The whole nerve, say the sciatic nerve, it has numerous nerve cells. And now division of CNS. Central nervous system and consists of brain and spinal cord. Central nervous system consists of brain and spinal cord. You will see in our dissection hall the brain. Now CNS, central nervous system, consists of brain and spinal cord. Peripheral nervous system, central brain. Peripheral nervous system, any nerve outside the brain and spinal cord. Autonomic nervous system controls the involuntary body function. Autonomic, you don't feel it, but your gastric juice is secreted. There's other actions like I'm seeing you, and if there is too much of light, I'll be doing this. The pupil constrict, but you cannot feel it. I will just look at you. I'm in anger. My look will say if I'm in anger or I'm in a different mood. These things are controlled by the nervous system. Now, if I look at you like this, you will understand that I am angry. But I'm just casual, I'm looking at the things. Then these signals go to the brain. And that's why it is a riddle. It is still date. No one has discovered. The brain controls the mind or the mind controls the brain. You please look into your chat GPT and all this new AI mode and tell me on Friday or in your practical classes. I will acquire some knowledge. And your online platform, if they are saying something new, I want to learn. Now, central nervous system, the brain, mass of nerve tissue, protected by membranes of the cranium or the skull. There is you will see in your atlas, your pictures, especially atlas. Even you can see the Auckland's head and neck. You view those videos, you will get a better idea, better concept. I think I have not seen the or sat in front of any online teachers, but I am giving you, if you want to go with the fear, the nervous system, क्या पूछेगा, क्या होगा, इधर connection, उधर connection, don't. You just sit down, you take your pen drive, it is in the, you tell Avinash, you take it, and you see the skeletal element of the head and neck, and also the brain itself, and see brain, a mass of nervous tissue, and a mass. Now, protected by membranes, and protected by membranes and the cranium or skull. Cerebrum, the largest section of the brain, responsible for reasoning, thought, memory, speaking, sensation, sight, hearing, voluntary body movements. Cerebrum, largest section of the brain, responsible for reasoning, thought, memory, speaking, sensation, sight, hearing, voluntary body movements. I called your friend. I called him, hey, so. He was going to go in the third bench, but by his movement, his thinking was he will sit in the third bench, but I called him in the first bench. This feeling, this understanding, and what he is in, a person is in what motive, you can study. Cerebellum, responsible for coordination of muscles, balance, posture, and muscle tone. Responsible for coordination of muscles, balance, posture, and muscle tone. Any disease of the cerebellum, if a person has, he comes to your chamber like this, that I don't have any cerebellar problem, but he comes in like this, more or less. I will show you on Friday some beautiful pictures. Now, the cerebellar control, and see the portion where it is located. Please see in the your dissection hall, the specimen, please see it, please see it, please see it. I'm repeating that you see these, so you don't get lost when you are in the exam hall. Now, midbrain, responsible for conducting impulses between the brain parts and certain eye reflexes. Responsible for conducting impulses between brain parts, certain eye reflexes. Pons. This is the pons. This is a sagittal section, right and left hemispheres. This cut open. You see it. It will be the corpus callosum, the anterior lobe, posterior lobe, then your cerebellum and medulla, pons. Now, responsible for conducting messages to other parts of the brain, reflex actions such as chewing, production of saliva. Now, these centers are in the brain. So, reflex actions such as chewing, production of saliva. See, you take a bit of achar, saliva secretion is there, and you chew something that is responsible for conducting messages to other parts of the brain, reflex actions such as chewing, production of saliva. Medulla oblongata, lowest part of the brainstem, here, connects to the spinal cord, responsible for regulating heartbeat, respiration, swallowing, coughing, and blood pressure. Responsible for the medulla oblongata, the lowest part of the brainstem, connects to the spinal cord, responsible for regulating heartbeat, respiration, swallowing, coughing, and blood pressure. Spinal cord goes down the back of the body from medulla oblongata, surrounded and protected by vertebra, responsible for reflex action. You're ready. Responsible for reflex action, carries sensory and motor messages. Meninges consists of 3 membranes, covers and protects the brain and spinal cord. Please see it in the classroom. Feel it. It's paper-like, but don't destroy it. The beautiful spinal cord covered with meninges. Now, it protects the brain and spinal cord. Now, 3 membranes, Dura matter, thick, tough outer layer, arachnoid matter, middle, delicate, web-like layers, and pia matter, innermost layer with blood vessels to nourish the nerves. When you see it in the specimen, you will see all this. So you don't need to do guesswork. You देखवे सोच से बोलो it's covered by meninges, Dura matter, arachnoid matter, pia matter. Pia matter, the blood vessels are there. एक बड़े पुरस्कार देखते पाओगे. If you want to study, then have a magnifying glass. একটু magnifying glass দিয়ে দেখবে. বা ভালো তোমার ফোন থাকে যদি, যার ক্যামেরার পিক্সেলস গুলো খুব high up range, you can take a thing and then you see that picture, and then you enlarge. You want to see, you can track or scan the whole brain. And see Magman's Atlas if you have, or you download if you can, by any device. Now ventricles, four hollow spaces located in the middle of the brain, connected to each other filled with fluid called cerebrospinal fluid. Now, four hollow spaces located in the middle of the brain, connected to each other, filled with fluid called CSF, cerebrospinal fluid. Now, if you see the cross section of the brain, or you see your sagittal section, you will find the ventricles that is connected to each other. If you see a CT scan plate, so if there is a tumor over here, then this is pressing. So this this goes and presses. That ventricle space is reduced. Now, you are working as a radiologist in Bolpur, and you are connected with Chandigarh 3-4 centers. You sit at 8 p.m., all the reports, you give the report. The CT scan or MRI, they are done by technologists, but the doctor gives the report. On online, there is a report, of course, if it's in the department. That's why all centers who are working in this mode, the report of MRI is given after 3 days, report of CT scan is given after 2 days. But institutes, if you need it in an urgency, I think they will deliver the report of the main areas that is creating a problem. And your cerebrospinal fluid circulates continuously, serves as a shock absorber to protect brain and spinal cord. Now, if there is meningitis, encephalopathy, you have to do a CSF study. And if it is traumatic, then you do a CSF study. In the level of in the spine, you put a needle, you get these needles, spinal needles. It is, you put it, and then the fluid will come. Take it in the test tube, send it for microscopical examination, send it for pathological examination, and get the report, and accordingly you treat. These things have to be noted that if a patient of high pyrexia, tremendous pyrexia, 102, 103, not getting remitted, then you please, at least clinically, you will know if it's due to malaria or your typhoid. The clinical symptoms. Everyone is having a temperature, you come with a needle, don't. That's why you have to make your clinical knowledge in medical practice everywhere, in the hospital, or you're having different gadgets and all this. There's a study was conducted in United States, multi-center trial. The most of the patient admitted in the hospital medicine department, they could be diagnosed with simple tests, with a hammer, with a needle, with a feather, to see the reflex, see the and a torch, see the condition of the pupil. So they have it in routine. So you have to be very judgmental to prescribe an MRI. MRI means 6,000 or more, and a CT is 1,500 or 2,000. So you know your anatomy, especially neurological examination, you can't this thing. I saw a patient 5 days back. She had an accidental injury in the spine, fixation with plate by an orthopedic surgeon. 2 months back, she was doing her daily course, walking like this. Suddenly, but she was a diabetic. And what happened? The peripheral neuropathy, diabetic peripheral neuropathy, she developed. Plus, there were diabetic foot ulcers in the leg also. Leg affected. As usual, I did honey dressing, but I sent for a nerve conduction velocity test. And there were your nerves, peroneal nerves and all were affected. Now, see the dilemma, complication, dilemma of diagnosis. Now, is it the plates and the fixation done has become loose and of the disc prolapse? Am I clear? Is it that, or it is due to diabetic neuropathy? So after seeing the report yesterday, I sent him to the doctor who done the surgeon, orthopedic surgeon. I referred back to him to note the condition of the vertebral column. So now cerebrospinal fluids circulates continuously, serves as a shock absorber to protect the brain and spinal cord, carries nutrients to parts of the brain and spinal cord, helps to remove metabolic products and waste after circulation absorbed into the blood vessels of the dura mater. Now, peripheral nervous system, made of all nerves outside the brain and spinal cord, consists of cranial and spinal nerves. Simple. Peripheral nervous system in the periphery. Now, peripheral nervous system, study. Okay. Cranial nerves, 12 pairs of and their branches. Some responsible for special senses, sight, hearing, taste, smell. Others receive sensation, touch, pressure, pain, temperature. Spinal nerves, 31 pairs of their branches, carries messages from the spinal cord, both sensory and motor nerves. 31 spinal nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, 1 coccygeal. Autonomic nervous system helps maintain a balance in involuntary functions of the body, but allows the body to react in times of emergency. Autonomic nervous system helps to maintain a balance in the involuntary functions of the body, but allows the body to react in times of emergency. Two divisions of autonomic nervous system: sympathetic nervous system, parasympathetic, counteracts like sympathetic after the emergency, acts in emergency. Sympathetic acts in emergency. Parasympathetic counteracts the sympathetic nervous system after emergency. Now, your peripheral nervous system, central nervous system increase the heart rate, increase respiration rate, increase blood pressure, decrease digestive system activity, decrease heart rate and decrease respiration rate, decrease blood pressure, increase digestive system activity.